I'd like to welcome everybody to another installment of Save My Piggies. This is the podcast for patients and physicians that have peripheral arterial disease and the physicians that treat peripheral arterial disease. Today we have our first installment of a patient, his wife, and then the fantastic physician that treated the patient. So I'd like to welcome Victoria and 𝐒𝐡𝐴𝐮. 𝐒𝐡𝐴𝐮 is the gentleman that had peripheral arterial disease, and as my understanding was threatened with possibly an amputation. They were able to connect with Dr. 𝐒𝐡𝐴𝐮 out of North Carolina. He did intervention, increased blood flow to his right leg, I believe, and now 𝐒𝐡𝐴𝐮's doing well. So I want to welcome all you guys to our podcast. Thanks for joining us. Again, this is going to be very low key. We just want to hear your story. So I think I'll start with Victoria and 𝐒𝐡𝐴𝐮. Can you tell us a little bit about your background, how you got to learn about the peripheral arterial disease, and some of the workup that came about prior to you meeting Dr. Rao?
Well, my husband had suffered with leg pain, claudication, some different things over the years. However, he never really had a vascular consult. They thought it was neuropathy because he is diabetic. So February last year.
It was actually you that asked my cardiologist to do the
vascular consult.
Right.
Yes. And so it started from there. And we went to a vascular surgeon close to where we live. So it started out that he did a stent, which did not last even 3 months.
Can I explore something, and Dr. Rao, I'd like you to chime in as well. It sounds like, first of all, Victoria, do you have a medical background, or do you have some knowledge behind? So yes, you I think have a little bit more awareness than a lot of the patients that we see, or family members that we see, regarding the disease process, because it is kind of an orphaned disease, in my opinion. There's not a lot of insight or
yes, sir.
education around it. But so you were referred. You asked for the referral, and your primary care doctor or somebody sent you to a physician or a surgeon. Is that right? I mean, you didn't seek out.
That's correct.
Okay, so I think we see this pretty regularly. You're almost at the mercy of whomever you're referred to, good,
Exactly.
bad, or indifferent. Okay.
Yes.
All right.
Yes. From there, of course, that stent failed within 3 months. So we went back. He went in and did 2 more stents.
And which leg is this?
This was his left leg, which he eventually lost.
Okay.
Yes. He said that he was not a candidate for a bypass, but he didn't do anything in the lower part of his leg. He only worked in the upper part. Again, those stents failed. And then in February in 2020, yes, he ended up losing his left leg above the knee.
So let's talk about that a little bit, because part of what Dr. Rao and I do, we're totally against amputation as long as we can prevent it, and we dedicate a good portion of our practices, I think, to treating folks that have critical limb ischemia and trying to prevent amputation. How did you go from what sounds like pain and claudication, pain in the leg when you walk, to now needing an amputation of that presumably healthy leg at one point?
Him along with my husband's cardiologist said that there were not many options out there, that they had done all they could do, that he didn't have anything to tie on to below the knee. And, we were left with, okay, where do we go from here? And of course, I looked and looked, and I didn't find this. I wish I had. As Dr. Rao can tell you, I was kind of joyous and sad at the same time when we seen him, because I thought, what if I could have found him before? But so from there, my husband was concerned because, his health is not the greatest. He struggled with diabetes. He has ankylosing spondylitis and a lot of other issues that are ongoing. And even though his diabetes is under control, it's wreaked havoc on his body over the years. So, he said, what if I wait and then I'm not able to, be able to wear a prosthesis or, because the doctor was putting it to him like, the sooner you do it, the better. You know what I mean? And
Right.
I was totally against it, honestly. I did not want him to do it. I thought, well, we'll start looking, but he was like, they had put it in his head that was his only option.
But so can I, just so we're clear for the audience, because there are going to be people hopefully out there that are listening that have been diagnosed with peripheral arterial disease, but maybe just have some leg discomfort when they walk. They have claudication.
Right.
And, I'm a huge advocate for trying a walking program and risk factor reduction and medical therapy before we jump into angiogram and stents. So he had claudication. Shane, you had claudication prior to seeing this physician involved in that left leg. Is that correct?
Oh, yes, sir. For years, I complained about my legs, and it would always go back to neuropathy.
But it sounds like once you had the procedure, the clock was ticking to repeat procedures. But then, and we see this a lot of times, the more, we do a procedure and then that can lead to another procedure and things get worse. And you obviously were worse off at the end of this than you were than when you started on that left leg. Is that fair to say?
Yes, sir.
So I think this is this is a cautionary tale that you guys are now able to tell, hopefully, a lot of people about really being cautious and thinking about who your procedure list is going to be for your peripheral arterial disease and being an advocate for medical treatment if you can. I mean, obviously,
right.
A lot of what we do is procedure, but at least I and Dr. Rod, I'd like to get your thoughts on that. I mean, I do everything I can to keep people out of the cath lab.
Yeah. I agree. Dr. Phillips, Kim, the drivers, thank you for allowing me to join you guys. So, Dr. Phillips, I agree with you. Claudication is not a limb-threatening problem. I barely treat any claudicants at all in our busy peripheral vascular practice. Probably about 5 to 7% of the interventions that we perform to open up blood flow are in claudicants. More than 92 to 93% of the blood flow that I improve in my patients are all threatened limbs, people with either pain in the feet at rest or ulcers or gangrene. And that's usually where the data is the strongest, saying that you should treat them endovascularly or with a bypass. So I personally never, ever treat a claudicant unless they absolutely force my hand after they have failed appropriate medical therapy, as you referred to.
Because, I mean, you've seen it as much as I have. You take somebody who has relatively stable disease process. I mean, PAD is an issue, right? And then now you've made them more unstable. And now, like Shane, he's lost that left leg and he's going to have to deal with the prosthesis, learning to walk again. And that's just, in my opinion, something that should never happen.
Correct. So just like Shane said, he had claudication for many years. First of all, it was a misdiagnosis based on what we hear. It was diagnosed as neuropathy, number one. Number two, the lack of a diagnosis meant that there was lack of appropriate medical therapy, intensification of risk factor modification, a walking program, maybe cilostazol, and all these things, because I know Shane doesn't have severe congestive heart failure. So I don't think all those were tried. And as we know, putting stents in arbitrarily, especially if you haven't done all these, can often lead to worsening of their peripheral arterial disease. And just like you said, you take a claudicant and then convert them into an unstable limb, like unfortunately Shane had to go through.
So Shane and Victoria, you guys are at the precipice of having to decide whether or not to take the leg. Walk us through that thought process, kind of what it meant to potentially lose that independence.
Well, I knew I wasn't getting any younger. And with the other health issues, I just felt like we did get a second opinion. My family doctor, Dr. Moore, is a great doctor, loving, think the world of him. He said, yes, let's get a second opinion. We went to Augusta Vascular, and the first doctor I seen down there agreed with Dr. Lampford. The next thing I know, I'm getting another test done down there. And at this time, I was having some heart issues, and I was wearing a heart monitor. And this real, and I hate to put it this way, but he was a real arrogant surgeon. He wanted to put, he described it to me just like this. It was like a piece of PVC plastic pipe in my leg. And his exact words were, your heart will kill you before your leg comes off. And of course, at this time, I was willing to try that. But the day we were getting in the car to go down to Augusta, the cardiologist called and said I couldn't have a surgery. I had to come and have a pacemaker along with cardiac ablation. And from there, that was just something that clicked in my mind. I'm not getting any younger. If this has got to be done, there's 3 doctors saying, you know, this ain't going to work. One arrogant surgeon saying that, you know, he could do something that I had no idea what he was talking about. He had no compassion, no care whatsoever. So I didn't want to go through one surgery that would take me 6 months to get over and then have to turn right around and have an amputation afterwards. So that's kind of.
How did you feel after you had the? What did it do to you?
It's been a struggle. You know, I was very determined. I walked everywhere I went on a walker. I chose not to ride. I pushed myself, and it was a really challenging mind game, I guess you would say. I don't know. I still struggle with it today. Of course, I know my wife. She's been a blessing. But, you know, there's times I know that she gets tired of me complaining, or I don't know how to say it. You know, I feel like I bother her a lot, in a sense, in my mind. But I don't sleep well. I still have a lot of issues.
So Shane, you touch on a couple of things, and Dr. Rao, I'd like to get your opinion. A lot of folks that have peripheral arterial disease have polyvascular disease, so other issues. And what at least I tell my patients is typically your leg is not going to kill you, but it could be your heart or stroke, you know, have a stroke or something along those lines. It sounds like, Shane, they wanted to do maybe a bypass to that leg on the left side. But it also sounds like the damage had already been done. So Dr. Rao, I guess, how would you have potentially approached, if you would have seen Shane, in hindsight's 2020, with respect to that left leg? I mean, what percentage of the, and I see this too, I see a lot of patients who, the horse is out of the barn, and there's really not much we can do. And you hate to say there's nothing you can do, but oftentimes amputation is the only option. How do you broach that topic with your patients?
Yeah, I think so. Each patient's story is different, but and again, hindsight is 2020, so we don't know exactly what happened. But in case of Shane, after his first or second stent, when it failed, if he had gotten to me, I think a thorough review of the records of his symptoms, his clinical exam, his ultrasound exam, and then an angiogram to decide if he really has disease below the knee and below the ankle. Because as you and I know, Dr. Phillips, disease above the knee or above the groin doesn't typically cause an amputation when patients have chronic ischemia. Yes, you can throw a clot down and then it can close off the circulation below the ankle or below the knee, and that can cause limb loss. But that's not the situation we are talking about. We are talking about chronic ischemia. And in chronic ischemia, really, you need operators, I think, who are dedicated to looking at the circulation below the knee and how best to restore the blood flow. So I think based on all we've heard so far, I didn't hear of anything about mentioning disease below the knee. I don't think the drivers have mentioned anything about this, about whether there was specifically disease below the knee, disease below the ankle, that people like you and me have dedicated ourselves to opening up, because
Yeah, I mean, the story is heartbreaking to me because, and it rings true. Honestly, where I'm recording this right now, I'm at an outreach, and 2 years ago, I saw a patient who had, it sounds like very similar symptoms. I mean, she had claudication involving the left leg, and a physician locally here attempted, and her SFA, so the thigh artery in her leg was blocked, and he attempted to fix it. And ultimately, fast forward now 2 years, she's going to lose that left leg because of all the complications that ensued from it. And it's just, if we can't take any, if there's the only take home message, if there's one take home message here, in my opinion, it's for the patients to make sure that they get that second opinion and are funneled to a physician, whether it's a surgeon, radiologist, cardiologist, whatever, who can treat them appropriately. Because there's so many places that, in my opinion, it's kind of a barber. You go to the barber, you're getting a haircut, hammer nail kind of thing, and that just is unacceptable. Because now, so now Shane's lost his left leg and he's fighting like heck to walk again. And it sounds like, Shane and Victoria, you were having some issues with the right leg, and share that story with us. And this is what ultimately led you to Dr. Rao and his ability to preserve the limb for you.
So he started having a great deal of pain in the right leg. We were set up for a follow-up with the vascular surgeon. I believe the original one was in November.
Is this the same surgeon that you had for the left leg?
Yes.
Okay, so let me ask you guys this question. You must have had some confidence in him to go back to him. Is it him?
This was actually a follow-up appointment
for his amputation. Yes.
Okay.
And so they did the test on the right leg, just because Shane told him, that he had been having some pain. And he said, oh, yeah, he said, it's getting worse. He said, come back and see me. We're going to do, an angiogram. I think they scheduled that for around February just to see where we were.
But you guys had, you had
meantime,
confidence in this physician, right? I mean, you still have confidence.
Well, no, I can't say that I do. That was just at that time, that was the only option that I knew, honestly.
Okay.
And if I may interject, Dr. Phillips, this is one of the situations that's the most heartbreaking about situations like this. Patients have now lost a leg and they have to continue to go back to see the same person that they have been dealing with. And I see this all the time because I practice, I have satellite offices in rural counties too. They don't know any more than what they do. And they are trapped in this lacuna of knowledge, unfortunately, that prevents them from gaining access to people like you and me who first start with the premise that amputation is not appropriate in chronic limb ischemia, and then try to save the leg first, and it's not the other way.
Yeah.
Yes. And that was the thing with us. You know, really, that was the only thing we knew. We had to go back to him for follow-up. And even me with a medical background, I don't know anything about vascular as far, you know, that's a totally different field. Just because you've been a nurse for 20 years, you know, you're not really up to date on vascular issues unless you deal with that on a daily basis. And
you obviously, you guys knew enough though to presumably think, okay, we had an issue with the left leg, now there's potentially an issue with the right leg. It sounds like you had the angiogram, and we're not happy with the thoughts or the treatment plan after the angiogram.
Well, when we went for the angiogram, this is what you know, which we didn't know we were going to be doing all these things. We thought we were just following up with the amputation. So we went through with the angiogram, and he never even came to the room and spoke with us after that procedure.
After that,
the nurse told us, she said, he, you know, she was like, he didn't come and talk to him. We didn't know anything at that point. And she told us that it was blocked 60%. Now, this was from the nurse because the physician never came. And when we went back to talk to him at his office, he said, you're looking at 6 to 8 months, you're going to have another amputation. And I'm like, you know, why? What is the problem? And I said, are you talking below the knee, above the knee? You know, what's going on? And he really couldn't answer those questions for me. And so at that point, I said, okay, I'm not doing this. And I had a really good friend of mine. We started looking on the internet, and she actually found Kim. And Kim reached out to me. And from there, Dr. Rao actually called me on the phone.
Can you tell us who Kim is?
Kim McNichols is, she's an angel to me. I mean, you know, she's just like, it was amazing. I've talked to her so much, probably at least 2 or 3 times a week. And, you know, I don't know a lot of her background, but I mean, I know that she advocates for these patients. And now, you know, I'm a rehab nurse. And some of the things I've seen in the past 2 weeks from this same surgeon, you would not believe. So I have started advocating as well. I've actually given cards out and, you know, just whatever I can do. I mean, it's so near and dear to my heart that I don't want to see anyone else have to go through what we've been through.
And just so the listeners know, Kim has a portal, blog, Facebook, the way of my heart is really, I think her way and a lot of our ways of raising awareness and education to the patients about peripheral arterial disease. She links patients and physicians, patients with other patients, and the Save My Piggies podcast can't really exist without Kim and Weight in My Heart. So we've got to give a shout out to her. We'll have a link on the blog and a link and all that good stuff. So anyway, keep going, Victoria. Sorry.
Oh, that's okay. So actually we were driving back from the mountains, and Dr. Rao actually called me himself. And
that's unheard of.
Yeah, that's unheard of in itself.
Here.
And that's so let's pause there for a second, because I want to get Dr. Rao's thoughts on this. Why did you call them personally?
So John, I actually, now that I run my own practice that only does 100% of the time limb salvage, I keep actually a close eye on all my texts, emails, the fax referral line, and all our electronic referral sources, because to tell you the truth, I trust that I am the one that needs to be responsible for these patients in a weird way. I have a very intimate sort of relationship to PID, because my own grandmother actually died about 9 months after a BK. But this was a few years ago when, you know, she was in India. And so I know the burden that it places on a family, a small diabetic foot ulcer, gangrene, loss of tissue. So to me, this is a very emotional issue. So I always make sure that none of these referrals are missed. If Kim texts me, you know, I tell her the only time I don't reply back is when I'm in a case. So when Kim texted me Victoria's number, I said, look, I'm not going to wait for any referrals. I'm just going to call this lady because she seems like she's been through an ordeal, and so is Shane. So I just called them up and I said, hey, look, my office is going to call you on a Monday. I have given them the information. So I have this very tightly knit group of people in the office that communicate with my patients. So I often call them a lot of the times myself because the front desk staff or the referral coordinator may be busy. And, you know, if I have some free time, I try to make sure that everybody gets in because time is tissue, as you and I know it.
Yeah, I mean, that's an interesting philosophy, and that's one that I kind of share as well. I'm an employee of a large health system, but I think a lot of times patients feel like there are a lot of roadblocks to them getting to a physician. And, you know, you have on one hand patients who, if a physician says something, it's often deemed gospel, and they will do whatever that physician tells them to do, whether it's right or wrong. And then you have some patients who I think question a little bit more or dig a little bit deeper. But either way, you have a lot of silos and roadblocks built in between the patient and then you as the physician. And I mean, Kim is, in the sense, breaks it down and just starts texting. And then all of a sudden now we're calling the patients directly. Now we're talking to them on a podcast. I mean, I think the other take home point for listeners, and Shane and Victoria, please share your thoughts on this, is that, you know, physicians are pretty easily accessible, those that want to be accessible. I mean, with texting and Facebook and stuff.
There
are a lot of doctors.
I mean, I give my cell phone number out. Yeah, I give my cell phone number out to my patients because, you know, I know they're not going to abuse it. They're going to call me when they need me. And when they need me, you know, I kind of feel like I need to be available.
That meant the world to me. My doctor in Greenwood, the vascular surgeon, when he told me with my first amputation, it was short. It was, you know, we're going to have to amputate, put your shoe and sock back on, and they'll meet you up front, and walked out the room. So for Dr. Rao to pick up the phone and actually call himself, that was just extraordinary. It meant the world to us that he would take time out of his day, not even knowing us, and call. I can't say enough about that phone call.
I think, you know, something like that just adds another layer of comfort and confidence in the physician.
Yes, sir.
All right. So you hooked up, Dr. Rao, and then ultimately they came to come visit you?
Yes.
Okay.
And by the time we got there, my husband, he really couldn't walk 10 feet without his leg giving out. So we were really in a bad state, you know, because he has the prostheses on one leg, and then now the other leg is failing, and he was very frustrated and depressed, and I as well. And I will never forget, you know, when Dr. Rao called me back there, and I was just crying, but it was happy tears, you know, and it was sad tears at the same time, because I told him, you know, if only I would have sought you out before, you know, that's my only regret. But, you know, I thank him so much for what he has done for us. You know, we can go out, and yesterday we went out, and Shane's been walking a lot, and it's just amazing at the difference. It's absolutely amazing. And it was immediate. It was immediate.
Yeah, no, and Dr. Rao, comparatively speaking, it sounds like the disease that Shane had on the right side wasn't all that critical, or at least in your mind, something that would warrant an amputation, first of all, but it sounded like it wasn't too hard to spruce up and fix, right?
Yeah, so this is the sad part of the story, John. Now we can be a lot more, at least I can be a lot more objective, because I know what his anatomy was on the right side after I put him on the table. You know, his, and I'm not trying to get too technical on our listeners, but, you know, his femoral artery in the thigh and his arteries below the knee just had some mild disease. All he had was an iliac artery stenosis above his groin. So I did a good quality diagnostic angiogram, and he had a nice pedal arch, good blood flow below the ankle. And I'm thinking, what is it that is amputation worthy here on the angiogram? So all we did was really fix a focal iliac lesion that was about 90–95%, and then a sort of proximal common femoral or a distal external iliac lesion that just needed some balloon angioplasty. It took us about 30 minutes to do the whole diagnostic angiogram and fix this with one stent and close the groin. And he was, you know, ready to go back home in 2 hours, feeling much better. And I cannot, for the life of me, understand what was on that angiogram that would portend a prognosis of an above the knee amputation in a 50-something-year-old. That just blew my mind when I looked at those pictures.
Yeah, I mean, when I saw the op report or whatever it was, I couldn't really put two and two together. And clearly now you sharing the story, it doesn't make sense. But I think it just highlights the fact that if the patient, I mean, if we don't continue to do things like this, and Kim, through Weight of My Heart, doesn't do what she's doing, and now Victoria and Shane are advocates, you're obviously an advocate, you know, folks will ultimately succumb to what the physician tells them. And for Shane, I mean, to get another amputation is tantamount, in my mind, to a death sentence. He's never going to walk again. I mean, that's crazy. Yes. That's absolutely crazy.
You know, I hate to say this, but this is important, I think, because while in one way it's kind of a cruel joke, but it's also the reality. You know, there's a joke amongst physicians like us, Victoria and Shane, like Dr. Phillips and I. We say, why do we not see too many double amputees in our clinic? You know why? Because most of them are dead, unfortunately. Yes. Because major amputations hasten death. That is something that you are never told before a major amputation, unfortunately. So this is why, you know, Dr. Phillips and I are so grateful to people like him who take time out of their life or make it their life to educate patients. Because it helps people like Dr. Phillips and I to render care that is necessary. And like I said, I'm not being overly emotional, because I know the toll it takes, amputation takes. My grandmother was bedridden for almost 6 months and lived miserably before she died. Bed sores and aspiration pneumonia, DVT. I mean, this was a horrible, horrible way to go. If you don't walk, you end up dying. It's as plain as that. I did a community awareness program at a church recently, where it was a small congregation of about 100 people, and I saw 7 or 8 people that I could count from the dais, all in the prime of their life, between 45 and 65 years old, walking in with a prosthesis or coming in on a wheelchair. Out of a congregation of about 100, I saw about 7 or 8 people. Wow. That to me just blows my mind. And when I was talking to one of my patients who actually asked me to come and talk to them, I said, what is this? This is 7% of your congregation without legs. And she said, oh, this is nothing. You should come into my neighborhood. It just blows my mind to hear stories like this. It is not necessary to lose your leg as the first line of therapy. It's not even treatment.
Exactly.
You know? So Shane, it sounds like, when did you have the procedure with Dr. Rao? A couple weeks, a few months ago or something?
7 weeks ago, I think. 8.
7 weeks ago. All right. So how are you doing now? Sounds like you're walking, doing pretty well.
Oh, I couldn't wait. I probably shouldn't have, but when we got back to the motel, I rested for a little bit and then slipped outside without my wife knowing and started walking just to see, before I couldn't walk, 2 minutes, and that was it. And I walked and walked and walked, trying to make it see if it was gonna, stop me. And it didn't. I just kept walking.
So,
It was
so it sounds like
amazing.
that's all. I mean, it sounds, obviously he changed your life, the trajectory of your life now.
Yes.
What are you doing differently, knowing what you know? So for example, you have diabetes, right? Sugars aren't under better control now. Are you motivated more?
Yes. I had gotten depressed, really depressed, angry. I was angry. I was angry at myself for the choice that I guess I made, because my left leg didn't hurt near as bad as my right leg. I could keep walking on my left leg. I just had to deal with the pain. My right leg, however, would stop me. I would have to stop. I'm not very educated, but the only thing I can tell you is that I believe in the Bible, and the Bible speaks of gifts. And I know that you three have that gift. And again, I can't thank Dr. Rao and Miss Kim enough. And we've learned a lot about our surgeon over here in the past couple months, I guess you would say, that I want to go over there and hold up a sign and protest amputation, because I believe in my heart that this is all he cares about. I don't think he cares about me as a patient at all. And I know there's others, and that's the only peace of mind I can get now is people like Kim and Victoria now, and Dr. Al is, if me losing my left leg could save somebody from losing one of their limbs, then that's the good that can come from it.
That's an incredible thing to say, Shane.
Yeah, I don't know that we can top that. I think the way I usually look at things, or at least I try to tell my patients, is life is a book, and several chapters have closed, and that the chapter, the amputation for you is closed, but now you got a new chapter that you're going to write about. You have your right leg, and you can keep walking. And I mean, that's I think a great way to close this out. Dr. Rao, any final thoughts?
So, first of all, I'm very grateful to both of you guys, Victoria and Shane, coming on and sharing your story. I mean, it couldn't have been easy, knowing that the whole world is kind of going to listen to your story. So thank you very much for sharing the story. But I think the biggest takeaway, as all of us have kind of alluded to, and just to quote Dr. Phillips to close this off, I think it's important for you now probably to spread the message around just in your community, in your church, in your grocery store. Yeah, I don't know, in your family circle, in your friend circle. Just let them know, hey, if you have diabetes, take care of yourself, keep your HbA1c under control, get your blood pressure under control. And if you have any pain or sores in your feet, that's your body telling you there's something wrong. And then, you can always ask Kim for
Yes.
help and say, who can we get an opinion from? Unfortunately, getting an opinion from the right person maybe was difficult a few years ago, but now with Kim being this beacon of hope for people like you, spread the message around that Kim's always available, she's always reachable, and that she's a resource that patients can use. And just say no to amputation if that's the primary treatment that's offered.
Yes.
Yes, sir. Yes, sir.
I think it's through medium, Facebook, social messaging, networking, whatnot, podcasts, things like that. I mean, this has to be a grassroots effort, in my opinion.
Correct.
And I can't thank Victoria and Shane enough. Like Dr. Rao was saying, this is a tough story to tell, but my hope is that, you know, this hits a lot of people and they tell other people. And really, I mean, you know, what Dr. Rao and I do, I mean, it's pretty simple a lot of times. I mean, it's a lot of common sense stuff, but you'd be surprised. And you guys know what's available and what isn't. I mean, we're not miracle workers. We're just trying to help people like everybody else. And thank you so much for sharing your story. Sid, thanks for coming on.
Sure.
It's you saved some piggies, and we're really happy that you guys could share your story with us. So with that, we'll end, and please, we'd love to hear, Shane, how you're doing 6 months, year from now, and Dr. Rao, hopefully we'll get you back on and tell another limb and life-saving story.